Hello everyone, I am Prema here, and today this lesson is on nursing research and statistics. Welcome you all. We will discuss the meaning of nursing research. We all know the nursing research is an essential part of professional nursing practice and it helps nurses to understand the clinical problems, find reliable answers, and improve the quality of patient care. The research is not simply searching for information on the internet or not just even reading the books. It is a planned, systematic, and scientific process to answer the question and generate trustworthy knowledge. So, by the end of this lecture, you will understand what is the nursing research means and how it begins and how it contributes to the better nursing practice. So let us begin with short clinical story. A nurse working in a hospital ward notices that several bedridden patients are developing pressure injuries. So the body is if you're seeing in this video, the body is in the prone position where the head is in the supine position. Fine. Okay. Just by mistake the error has happened. But still you see, the nurse noticed that several bedridden patients are developing their pressure ulcers. Then the nurse, instead of accepting it is unavoidable, she had a question. Can this problem be prevented better? So the nurse examines the information related to regular repositioning, skin assessment, and the use of pressure relieving support surfaces. She studies that the evidence are available and also evaluates whether a bed prevention method will be can reduce the pressure injuries among the bedridden patients. The findings can then be used to strengthen the nursing care and also to improve the patient outcomes. So by saying this, we understand the research always begins when we, as a nurse, ask, is there a better way? When we, as a nurse, why it is happening? A nurse, how it is happening? And a nurse, how I can prevent it. Fine. Nursing research is a systemic and organized inquiry. It is conducted to answer the nursing questions and also solve the clinical problems and also generate the reliable evidence to improve the patient care. Fine. So the first one we are seeing here, we are having as a systematic and organized inquiry. This means the research follows a planned sequence of the steps. The research identifies the problems and formulates a research question, collects the data, analyzes the findings, and comes to the conclusion. Example, studying the causes of the patient falls in the what? Coming to the next. The nursing research answers the nursing questions and it helps the nurses to investigate, to find out or to get the answers for the questions what they are having. And next, if you are seeing, we have as a third, nursing research helps to solve the clinical problems. Healthcare settings contains many repeated problems. It can be the pressure sore, it can be the falls, it can be the infections, it can be the pain, or it can be the medical errors. So this research helps the nurses to understand what is the problems and identify the safer and more effective solution. And next, if you are seeing, we are having here as a nurse research generates a reliable evidence. Reliable evidence in information is obtained through an appropriate and the systematic method as we have seen as the first. And it is more trustworthy than assumptions, than tradition, than statement such as, we have already done this, follow the same. Why I have to follow the same? You can find out the evidence that shows why the hand hygiene reduces the infections than closing our eyes and following the instructions by following our trend what we are using or the systems what we are following. We can just put a question and find out the answer. And if you are getting a better results, we can also change the things which for the patient outcome will be helping for us. Next we have here as a nursing research improves as the patient nursing care. The purpose of nursing research is not only to write reports or to publish articles. The research findings should contribute to safer, more effective and higher quality of the patient care. As we are having the example, the repositioning schedule of the bedridden patient reduces the pressure also. Coming to the next, we are having here as nursing research may focus on different groups like individuals or families or communities or the populations. It can also focus in one group or a one individual, or it also can focus on a larger populations. Example, studying about the attitudes or the knowledge related to the vaccines among the family members. Coming to the finally as a meaning of the research study. Nursing research replaces the tradition and assumptions with the scientific evidence. So always whatever we care, we are providing the care should be based on the proof, not as a habit or the opinion. And it should not be continued as opinion or the habit only because it has been followed for many years. That's what research is here. We can do the research and we can find out whether the practice is safe, whether it is effective, whether it is appropriate. When stronger evidence are identified, a better method, nursing practice may need to be changed. So the basic research process is clinical problems. See the clinical problems and formulate a question. And for the question, find out the answers by going in a systematic, organized way. And this becomes a create evidence and it becomes a better nursing care. Always remember, nursing research creates trustworthy knowledge for better nursing decision and better patient care. Now, let us check our understanding with a short question. Here a nurse notices repeated pressure injuries, collects the data, reviews evidence and evaluates new prevention protocol. Which part makes this nursing research? Is it following the routine care only? Or it is accepting the problem as unavoidable? Or it is ignoring the patient outcomes? The correct option is a C. You are right. It's a systematically investing the problem and evaluating the evidence. Hope you understood about the meaning of the research. Let us summarize. Nursing research begins with a clinical problem or an important nursing option. It follows a systematic and organized process. It generates the evidence, it solves the problems, it supports the safe and effective nursing practice. So, the nursing research creates trustworthy knowledge for keeping nursing decision and improve patient care. In the next lesson, we will discuss the importance of nursing research and examine and find out how nursing research contributes to the patient safety, nursing education, professional development, and also for health care improvement. Thank you for watching. See you again.